Welcome to another episode of the Wealthy Podcast. I'm your host, Shauna Nyros. And if you were to listen to the media reports these days, you would think that healthcare was irrevocably broken. However, there is so much going on behind the curtain that we don't know about, that is innovative, that demonstrates resiliency and real hope for the future of healthcare, not only in our community, but more broadly across our country. In today's episode, we are speaking with Jaymi Chernoff, who has had a variety of experiences working in healthcare, from a nurse all the way to her current position, supporting physicians and quality improvement in our health system. It is an episode that is really inspiring. Jaymi is a heart-led leader. You don't want to miss this one. In our quest to explore the many aspects of health on this podcast, inevitably, there is no escaping the truth that our health system in Canada is facing unprecedented challenges. Our goal with the Wealthy Podcast is to have real conversations about how these challenges are articulated in our community and highlight the ways in which people and organizations are addressing the challenges and empowering others to participate in solutions. And fortunately, as is evidenced by our robust roster of guests, there is no shortage of great work being done. As our populations continue to grow and evolve, along with our definitions of what constitutes health and health care, so too do the challenges and opportunities we face in delivering the kind of care people need. So, we are very fortunate to have someone like my guest today, Jaymi Chernoff, leading and supporting efforts to align the delivery of healthcare with the needs of patients and families in our region. Whew, this is quite the intro, Jaymi. There's more. Jaymi has been a good friend of the KGH Foundation for many years. We first met when she was the program director for KGH's cardiac services. And do you remember that? It was a photo shoot.
I do, but it is Interior Health Cardiac Services. So it's a region program.
Got it. Okay. Mm-hmm. Thank you for the clarification.
Yeah. There's a lot of services here at KGH, but it is a region-wide program.
That's right. Mm-hmm. And we actually met at the offices off-site.
Yep. And
it was a photo shoot. And I think you were pregnant.
Probably.
So that tells you how long ago it was.
Yeah. I was definitely pregnant in that role.
Yeah.
Mm-hmm.
Yeah.
Mm-hmm. It happens.
Anyway, Jaymi was celebrated in that role. And you're right, IH's cardiac program covers the entire region. Mm-hmm. And Jaymi had responsibility to direct that program. Mm-hmm. And then in late 2019, she was appointed the interim executive director of operations for Kelowna General Hospital. This is where things get fun. Hey.
Yep.
Big job, basically responsible for running the hospital, managing capacity and the distribution of resources to ensure the best possible care for KGH patients. So on a good day, that's a tough job. And then on March 12th, 2020, this is so serendipitous, hey? Mm-hmm. Jaymi officially accepted that job. So basically the director of the hospital.
Correct.
Which, if you're keeping track, was the very same day that the world basically shut down and the pandemic response began.
Yeah.
Wow. So Jaymi's here to share about that experience, but also to talk about her new-ish gig as Interior Health's Executive Director of Quality and Patient Safety. Jaymi is a passionate supporter of the KGH Foundation and has been instrumental in a number of our campaigns, including the current one, where she sits as a member of our campaign cabinet. And she's a wife and she's a mom to two amazing kids, and one of the most inspiring female leaders in our health system. So,
oh my gosh.
Welcome, Jaymi.
Wow, that is quite the intro. Thank you very much for that. Yeah. Mm-hmm.
So we have an opening tradition on the Wealthy Podcast. Basically, everybody that comes to have this conversation comes with a passion for healthcare, a real deep-seated passion. Mm-hmm. And it's usually informed by something that's happened in their life, maybe early on. Mm-hmm. Can you share kind of how you got here? Like, what, tell me about little Jaymi and maybe some of the first instances where you had an awareness about what health is and healthcare?
Oh, absolutely. I'm still blown away by that introduction. Thank you very much.
I'll give it to you. You can use it in your
I'll need
bio.
it for my resume. Absolutely. I'm a bit of a cliche when it comes to nursing because I really truly went into the profession because I wanted to make a change. So in my family, I did experience needing to interact with the hospital and healthcare. Both sets of my grandparents were in and out of the hospital. They had multiple conditions, and just seeing how healthcare workers just can support a community and the impact that they can make on not only the patient's life but the lives of the families is just always spoke to me. And so I was born and raised in Kamloops, and the Thompson Rivers University had a great nursing program, and I was just able to go into it. So truly it is just, I've always seen that I want to make a difference in people's lives, and it's everything from having the clinical knowledge to the power of holding a patient's hand through whatever life transition that they are going through, and that has always spoke to me. I myself had to rely on some healthcare. I've got epilepsy by background, and so I always had a great team of physicians and teams that were there to support me. And again, it's just something that is just always resonated with me. It is truly my passion, healthcare and helping people, and so it was pretty easy to make that transition and make the decision to go into nursing. And then just by happenstance and circumstances and the opportunity for experience, I started to see that leadership was just something that, again, lit my soul on fire, because it's a different way of being able to impact lives and support other healthcare workers through what they're going through and the work that they need to do. So,
and you are, it's been really awesome to see you progress through your leadership journey. I know you're an amazing nurse, and that has really informed a lot of the approach that you take to your leadership. I would say heart-centered leadership, for sure. Definitely having worked with you on a number of campaigns. So you mentioned that you began sort of your career in healthcare as a nurse. Yep. So tell me about that experience. Like, what did you learn? What was it like? What are the things that you took away from being a nurse that have carried through the trajectory of your career?
Absolutely. So I did my nursing school again in Kamloops at Thompson Rivers University. I actually graduated in 2001, which feels like a long time ago now. And interesting, at that point, the nurses in BC were actually going on strike. And so it was one of the last times that they did a work to rule strike. And so not very many nurses in BC were taking students for their final practicum. And so I actually had the opportunity, I had a very small graduating class. There was only 26 of us. And so if we had any connections in a different province, in a different country, we had the opportunity to go there for our practicums. So I ended up in Calgary at Foothills Hospital, and I actually started on the burns and microvascular plastics unit, and then did that for about a year. And then I transitioned down into the intensive care unit. And that just was such a fit for my personality, my passion, and just the experiences, again, just dealing with families and patients in the most devastating sort of healthcare event that could ever happen to them. Just the impact it can have, and the value of just connecting with people on a very, very personal level just filled my cup. It filled my personal cup. It filled my soul. It filled my cerebral cup. Like, it's just the clinical knowledge and stuff. So again, the power of making human connections. And nursing is a profession that I just feel very passionate about. It is in my blood. And I have so much respect for it. There are hard jobs in healthcare, and there are harder jobs in healthcare. And so there's nothing easy in any healthcare profession these days, nor has it ever been. But it just, the power of that connection. I don't know if I can't think of another profession, and this is true to any profession in healthcare, but for me, it was nursing, where you can truly connect with people on that level. And I think it's a gift. It's an absolute gift. And it's something that should be treasured.
And for you to have that experience, like working in, and I imagine that regardless of where you began your career as a nurse, you would have been impressionable, right? Like, I imagine in the ED, there's certain things that, nurses learn very quickly. Absolutely. But being in the ICU, we had Dr. Ryan Foster on the podcast a few weeks ago, and he really shared some of the nuances that are embedded in providing care, like critical care.
Yep.
Maybe can you share just a little bit some of the things that, you know, were a surprise to you? Because I was a communications major. I on essays in university. Sorry, I have to bleep that out or whatever. But so like health sciences for me is a bit of a mystery. But I assume that when you're in school, you're learning about sort of the clinical care bit.
Yep.
And then you get put into sort of practice. And so what things did you learn in the ICU? Was that a surprise? Like, was it were you surprised at the level of intimacy, I guess? Yeah.
Absolutely. But, you know, my passion is ICU nursing, critical care nursing. But I would say that the intimacy could exist in any specialty or just nursing in general. I did have some experience working in the emergency department. I actually had, for my 3rd year nursing practicum, I actually did it in Nepal.
Oh, wow.
And so got a variety of different experiences working in, you know, hill tribes and the, you know, Annapurnas and crazy experiences. I even did some nursing on cruise ships. Oh. And so it doesn't matter.
From one end of the spectrum
to the other. And the intimacy is definitely a big one. And I think for me, what ultimately surprises me is, and it's still the learning, is how resilient the human body is and what it can go through. And just how far we can take it or not when you're looking at it from a medical perspective. But just, like, I mean, it's, human beings are just fascinating. They're fascinating. And again, the work that all healthcare professions do is outstanding. I remember I had my experience in ICU before I went into emergency department nursing. And, you know, as an ICU nurse, you're used to your machines and all of your tools that are in your tool chest. And then you go into ICU and these staff are amazing. They can spot things 50 yards.
You mean the ED?
In the emergency department. Yeah. So like in ICU, we have all of our tools and we've got usually 1, maybe 2, sometimes 3 patients in front of us. So it's a much lower ratio than on general nursing or in the emergency department where they have much more. But they are just amazing assessors. Like, they can spot things and they know how to respond and they know how to act and they know how to balance multiple plates in the air. Like, it's truly outstanding. And it's truly outstanding in terms of what it is. So again, just the resiliency of humans, healthcare workers and patients and what a body can go through. It just always is just, I'm always in awe. Yeah. And what people can recover from. Obviously not everybody does, but you know, what healthcare and health science can do is just, again, it inspires me.
And I love that we're having this conversation because there's no question that it takes a lot of commitment and dedication to be trained and have the clinical skills to be in nursing or any other kind of area of healthcare delivery. But the human relationship piece is something that, and I hate to say this, but sometimes you only hear about it in the context of when things don't go right. And I know just from being in this role and working with people like you for the last almost 9 years, that in fact, it's just the opposite, is that there's so many people that are working in extreme circumstances, and it has been hard for the last few years, and we can talk about that. They're there because they do care, like profoundly and deeply.
Absolutely.
Yeah.
And it's not even just the nurses or the healthcare team with the patient. Like, I mean, again, some of the experiences that you go through. I do recall one of the patients that I looked after in Foothills ICU back in Calgary. And it was it was a mother who had a stroke, and it wasn't going to end in a way that she was ever going to be discharged from the hospital. But I was able to form relationships with that family, and actually even just I left Calgary in 2008. And just a couple of years ago, one of the sons of that patient actually found me on Facebook and reached out
No kidding.
and just was so appreciative of the experience of that transition. And again, I just can't think of another world where that happens. So it's not only just with the patients, but it's also the team that you work with. So when you are in these professions and you are, faced with extreme circumstances, and this health authority has definitely seen its fair share, the world has, with the pandemic and the emergency responses, but even just the very tragic cases that come in, the bonds that form with your coworkers is, again, something that would never be broken. So every department I have ever worked in, we may not see each other all the time, but some of those bonds and the people that you worked with never get broken, because there's only a select few people that can ever relate to that experience that you went through. So it's like having a sibling sometimes, right? And so those bonds that are formed are just outstanding. And what I am seeing now, even in this health authority, is just that even extends to the community. Like the community rallies around healthcare workers, and this is an outstanding community for that. And again, it's so incredible. Like literally gives me goosebumps. Yep. Mm-hmm.
You were so great. I'm going to kind of fast forward a little bit and talk about what it was like to be overseeing hospital operations during the pandemic. Mm-hmm. But I also just wanted to express my gratitude to you, because even as you sit here in the early stages of this conversation, you're such a good steward to the work that's being done for the people, like the people that are doing the work. And you actually were that person for us, even amidst all of the stuff that you were going through. Running the hospital at that time, you were also kind of like our ad hoc spokesperson to thank the community for the support that they were demonstrating for the staff, because the staff couldn't do it at that time. And there was so much going on. But every time we asked you if you could speak on behalf or say something, you would talk about the things we asked you to talk about. And you would always sort of either preclude or conclude that conversation with immense, gratitude, not only for the healthcare staff, but for the community support. Yeah. So thank you for that. Oh, I never actually got a chance to articulate that to you. But when I was prepping for this podcast, I just realized how amazing it was of you to sort of step into that role so authentically. I know. So embarrassing.
It is.
So, okay. So let's talk about, first of all, you accepted the position as executive director for Kelowna General Hospital on an interim basis.
Yep.
Did you sort of know? I've always wondered this. It was interim. You accepted it in January of 2020, and then you accepted it fully on March 12th. Did you know in January that the sort of interim bit was going to turn into a permanent position? Did you hope that it would? Or were you just sort of like, I'm going to try this out and just see how it goes. And if I don't love it, I'm just going to go back to, I can't even remember what you were doing before that.
I was doing the cardiac program.
So which was a good gig.
I loved that role.
Yeah.
And it was very rewarding. I learned so much. I really enjoyed having a role that was responsible for something regionally. And again, there are cardiac services that are offered here at Kelowna that are not offered anywhere else. Cardiac surgery, the electrophysiology program, the TAVI program. And so I was really happy there. And the opportunity came up, and I was approached by the VP of Clinical Operations at the time, Dr. Shauna Letwin, if I'd step in the interim. And I was just like, it will be a good experience. I'm always looking for experiences and how can I expand my learning. And I'm always honored when I'm asked to do something that somebody has the belief in me that I can do it. So I was very humbled with that. It was posted up as a permanent position when I got asked to do it on the interim. But they wanted to be very mindful about the decision and the selection process. And then after doing it, I did really appreciate just having a different perspective, so I could take the learnings from the cardiac program and now apply it to the largest tertiary site in this health authority, and sort of just to continue to expand my learning and my knowledge and my professional growth. And again, it was such not an easy site. There was nothing easy about the job, but the people again are just so amazing here. Every single member, from again the the support staff, to the physicians, to the nurses, is like, yeah, this is a role that I'm happy to be the captain of the ship for, because the people are so amazing. So, and again, that's always what inspires me. It truly is. And so when it came time to make the decision, it was an easy decision for me to make. And I was going to grieve over not being with the cardiac program, but I was excited for the new chapter. So I did get offered the permanent job. I think it was about 8:00 in the morning. I got the call to say that, Jaymi, will you accept this position? So I said yes. And I think it was 9:00 that the public health state of emergency was declared. So
did you know that was...
Well, it had started the fall before. And so there was rumblings in, fall, October, November of 2019, that there was this virus and it was starting to grow and it was starting to become concerning. And I can't remember, but what was going on in Italy was really big and obviously very, very concerning. So it wasn't a surprise that the public health state of emergency was declared. It was going to be a matter of when. And you go into those roles, and any role, without a recipe card. You don't have a roadmap. You don't have a recipe card. But all healthcare professionals would say, like, when a patient comes in, you don't know what you're dealing with. You have to do an assessment to make a plan. So, okay, let's get together. We'll assess the situation and make a plan. Yeah. And so, yes, I was happy to be the steward, but it was done in truly a team fashion. We instantly started coordinating committees and, meetings with different departments, different medical divisions, and all of the leaders. I'm like, what do we need to do? What do the units need in order to be successful? Working with our regional programs, infection prevention and control, population health, public health. And we just all worked together, and we made the best decisions that we possibly could with the information that was available. And it wasn't always, what was going to come in 5 days wasn't always available on the day that we needed to make the decision. So, looking back, hindsight is always 2020. And are there things that we could have done differently? Probably. But I truly believe that, again, the decisions that we made were the best that we possibly could have at the moment. So,
and to your credit and to the credit of your teams and basically everyone on the ground here at KGH, I believe this hospital was celebrated for its response during the pandemic. It was well coordinated, well communicated, again, to the best of your ability. What did you learn about the responsiveness of health, like the potential for responsiveness in healthcare?
Oh, I keep coming back to the word resiliency. So I will say, I said then, and I continue to say now, that every single day that I walked into the hospital, there was 3 emotions that I always felt, and it was motivation, inspiration, and pride. Wow. Yeah. So because every single day I would walk into the building and connect with the teams, and I was just blown away by just what I was seeing. And so for health, like, everybody's world was turned up on end. Everybody was trying to figure out, how am I going to get groceries? What do I do about childcare? What do I do about... And so for healthcare workers, they were doing that at home and coming into a hospital and figuring out how we were going to now care for an entire community or a society. And that takes a special something. And people showed up every single day. And I recognizing now that, we all know that we're facing staffing shortages, and there's a lot of work that we need to do to get back to our pre-COVID state. But they show up every single day, and they put their hearts and souls on the lines to care for the community, and everybody is just doing the best job that they can while trying to figure out what the world is going to look like. It's just outstanding. It's absolutely outstanding. And so I truly believe that we would probably have hiccups along the way, but there was no problem that this site couldn't be faced with and not get through. And it was when we thought that we had gone far enough, like, oh my gosh, now we've got COVID. It was COVID with wildfires, COVIDs with atmospheric rivers, COVID with, and it was a lot. It was a lot, and bus crashes, and they just continued to show up, and it was just amazing. And it's just there are many times where thank you is not enough, and it's true profound gratitude, and that's truly what it was every single day.
Were there any moments, you mentioned that, like, there were sort of layers to crisis that we'd never experienced before. Were there any moments where you were just like, I don't know if I can do this?
100%. There was lots, and I think a lot of people would be fibbing if they said they didn't, but and that's the type of leader I like to be, is I never for a second thought or ever think that I have all the answers, but working together as a team and getting input from everybody, and again, trying to make group and collaborative decisions. More often than not, I didn't necessarily know what the path was going to be, but working together, we always came up with a plan.
Yeah, it was remarkable. I remember, there was a lot of, for lack of a better word, drama at that time.
Yep.
And at one point we had a protest outside the hospital. And I'm curious, what was that like being on the inside?
I can actually get a little bit choked up about it. It was hard. It was definitely very hard, because it felt like overnight that we went from healthcare heroes to all of a sudden people screaming at the front door for something that was outside of our span of control.
Totally.
Vaccine mandates and, again, some of the public health orders. Those aren't decisions that we make in one hospital, but I recognize as a hospital we're a symbol. And, some of the impact on some of the staff, hearing the yells and seeing the signs, and it will truly be a day that I will never forget. And it's just a mix of emotions, like what has happened where in the blink of an eye, we can go from rallying together to all of a sudden being divided. But again, the staff in the hospital, they were affected, but they went back to caring for the community. So the very same people that may or may not have been, yelling outside or holding a sign, we welcomed with open arms when they came into the building. And so to be able to check any biases or to check any feelings at the door is what healthcare workers do. And they did it. I think, there'll probably be some scars and some lasting emotions from that. I know there are for me. But we made it through. And we will continue to, or healthcare around the world will continue to grow from that experience and learn from this. But that day will truly be something I'll never forget.
And thank you for sharing, because I think that sometimes we lose that perspective. There were some very valid questions during that time that everybody was grappling with. And, to your point, I think the hospital is symbolic. I remember what happened after that, because my desk is situated such that I have a window where I could actually see the front of the hospital. So the demonstration was literally right in front of my office. And I, as the communications person, I just was like, we have to do something, because I knew that there was also like that group did not represent the sentiment of the community. And so almost immediately we fired up a media release and asked the community to show their love and support again, and they did in droves, and to the degree that program is called the White Heart Project. Continues to this day, and we have supports in place where the community can provide, things like coffee and snacks. I forget what we call it now. No, it was giving. Oh gosh, Mel is going to kill me. But basically, where there is a situation where staff are required to sort of come together quickly. Brewing kindness. Thank you, Carly. Brewing kindness. Staff come together really quickly and have to deal with a situation that can be traumatic, sort of beyond the pale. Like this is something that we deal with in healthcare all the time, but when something is even more so, we have a service that's activated, that's funded by the community, where we can immediately respond and bring coffees and have supports in place and yoga or whatever it happens to be. And that was as a result of what happened that day. So I also want to just really steward the community for showing up for all of you and that moment as well.
Absolutely. No, and the community support on following that day and throughout was just outstanding. Not only, the support that comes through the foundation, which is outstanding and always has been, but I was inundated with offers of gift certificates for local restaurants and stuff. And you're like, oh my gosh, this is truly outstanding. And what's always interesting is that, sometimes, when these come forward, it is impossible for it to hit every single person. But even if it hits one person, it's made a difference. And so it was truly outstanding. Going back to the protest, one of the images that comes to my mind is for a little bit of it, I was standing on the skywalk, just, taking it in and just trying to formulate my own thoughts and emotions about it. But a group of nurses, and there may have been others, so I'm not trying to exclude anybody in this acknowledgement, but they stood with their arms looped in with one another. Like, we will stand united and we are going to stay strong. And, we are going to continue to do what we do. And again, just that whole community response, and even like internal community of healthcare. And again, the response from the external community is just amazing.
Yeah. Yeah. It was quite the time and the experience. And I'm grateful to you for stepping up and being in that role, because I can't even imagine, like, we have a saying around here because, we take on a lot here at the KGH Foundation. We're busy. We got stuff going on, you know, and, running the advertising, the marketing, and the podcast and all these things. And sometimes it's like, oh my gosh, it's so overwhelming. But I'll give credit where it's due. Our designer partner always says, it's just marketing.
Yep.
Well,
it's not just marketing, I would say. Like, it's interesting. I've got some friends still from when I was in Calgary, and it was actually outstanding because they knew the organization I was with, and they'd obviously seen some of the campaigns on social media with the White Heart. And even in rural Alberta, people were sending me pictures of rocks that had a White Heart painted at oil rig locations and stuff. Like, it had a massive impact.
It was cool.
And it was crazy. It was absolutely crazy.
I'm actually super proud of that campaign because, like, in as much as anything we do could go viral, that one did. It actually did. We had other hospital foundations. We offered eventually because we could see that others were trying to pick up the energy around it. And we did have other hospital foundations reaching out, and we just shared all of the assets we created in the process. But I mean, I guess, and I'm grateful that it was helpful and wasn't just marketing. But at the end of the day, like, if we make a mistake or if things are late or, the impact is much smaller than, say, the work that you do.
I don't know. Like, I would say, I don't believe that it was just marketing. Like, to do the work that we as the collective do in healthcare in these communities requires expertise from all over the spectrum. And so, yes, there's the clinical expertise, but the marketing that was done provided the support for us to do, or for the workers to do what they needed to do, or the frontline workers to do what they do. So it all comes together.
You are really sweet. Thank you. That's why we like working with you.
Feelings are mutual.
Okay. So I'm going to actually now kind of transition to your new position with Interior Health. So Interior Health is the health authority in BC that covers our region, which is a big region.
It's a huge region.
From Golden, I guess. Like, what's the most farthest east?
Cranbrook.
Okay.
Up to Alexis Creek and border in Asuyas.
Yeah. So huge. I read somewhere it's like the size of Germany.
Yep.
That's a country, actually.
That is correct. It is. Somebody once
Geography 10.
Somebody once overlaid just like New Brunswick as a province, and I think 5 New Brunswicks can fit into Interior Health as well.
Yeah.
Like, without the mountains and everything else taken into consideration.
Yeah.
But no, it's a big geographic area.
Also unique. We call them opportunities, but challenges. In the sense that, like, the region itself is quite kind of rugged.
Yep.
Right? So we have mountain passes, we have rural communities, we have winter, which can be intense and unpredictable. Yep. So all of those things are part of, like, when you take on a leadership role within Interior Health, it's not just for the Central Okanagan, which is where KGH site sits, but it's responsibility for all of the patients and families that live in a region that's the size of 5 New Brunswicks.
Absolutely.
No disrespect to New Brunswick, because but it's just it's a different suite of opportunities and challenges that we face. So now you are the Executive Director of Quality and Patient Safety. I don't know what that is, but you're going to tell me. Actually, kind of know, but I feel like it's something that I would want to do too. And it sounds like it's very suited to you, not only as a leader, but as a person. So tell me, what is the Executive Director of Quality and Patient Safety responsible for?
It's so with included in my portfolio, I've actually got infection prevention and control. It speaks to my clinical operation and COVID experience for sure. I've got the patient safety and the patient care quality office. So anytime a client or a patient maybe wants to call with an inquiry into the terms of the care that they received, maybe a care complaint, compliments as well, our office will take in those. We will investigate any events that happen that maybe didn't go as expected. And then we've got the quality improvement portfolio, which is, again, truly just driving change. And so taking an idea and looking at a problem and seeing if there's another way that we can solve that problem. And it really does, again, all of my experiences in interior health, I will frequently say it feels like I've won the job lottery 3 times. The cardiac program, the executive director for KGH, and now this, it's just been a perfect complement to what speaks to my heart and soul and my levels of interest. And so I keep sort of just expanding my experience. And this one is a really good fit right now. And because it's the opportunity. So when you're in clinical operations or in a role like KGH, it is really, really busy. All roles in healthcare are busy. Again, there's hard jobs and harder jobs. But everybody in the hospital is dealing with what's immediately in front of them. And that is short staffing, lots of patients, and providing care. But in order to get through what we need to get through in terms of the period that we're in with healthcare and needing to continue again to get back to some of where we were pre-COVID, as well as to continue to move forward, it requires people who can take the time and see things from a different perspective, maybe add some innovation, drive that quality improvement. And that's what this portfolio allows me to do. So I like to think I've got the experience of, working in clinical operations and, dealing with the day-to-day. How can I now support those people to continue to be successful with the team that I now have? And again, hopefully that's the goal. And so it really lights my soul on fire. When I was still with KGH, we actually had the opportunity to do a number of interviews with staff, some who were choosing to stay in healthcare and some who were sadly maybe choosing to go on to something else or another health authority. And so in total, I think we did 240 interviews.
Wow.
And the number one thing of people in various different roles across the spectrum. And the number one theme when we asked people, what would keep you in healthcare or what drives you to stay interested in healthcare, it was the opportunity to get back to quality improvement. And so I see this as our way forward, as the common ground that we can continue to be on together to have group collaboration and problem solving. So we have to look at things a different way. There's going to be some things that has worked for decades and will continue to work for decades, but there's other things that I think we can, again, continue to work together. And what's just a small little tweak or improvement that we can make that will not only improve the care that we deliver patients, but will also make it better and easier for staff, reduce moral distress, keep people retention opportunity, recruitment opportunity. This is what I see on this side of it. And I'm just so fortunate for the team that I have in this realm and the programs that I get to work with. Mm-hmm.
Yeah. And so, as you said, you had the experience of working during the pandemic in a job that allowed you to be really sort of boots on the ground. Mm-hmm. And you had shared with me just kind of like in a conversation before this one, just that prior to the pandemic, QI or quality improvement was, a really big part of clinician engagement,
Absolutely.
Right? And then necessarily during that period of time, those efforts had to sort of dial back a bit while everybody was being really hyper responsive.
Yep.
And then So you also shared though that you were hoping to sort of get back to that place.
Yep. Mm-hmm.
So can you share a little bit about that?
Yep.
Like what, maybe what people are feeling or thinking?
Yep. And some of this is just according, life according to me and some of my theories in terms of what I've seen and observed. But this health authority was very proactive in incorporating what's frequently referred to as lean methodology or lean leadership methodology. And Toyota, Virginia Mason, Theta Care, these are some organizations that have also embraced this methodology. And one of the principles behind it is that you take problem solving to the front line. So the people that are obviously, most connected with the work that we do and the core work that we do, which is patient care, having them drive solutions in terms of what we need to do differently. And so frequently a lot of our units would have these quality improvement boards, which is the frontline workers are identifying an issue, a problem, a challenge, an opportunity, and coming up with a solution. And then our role as leaders is to be like, okay, what solutions are within our span of control, and what are the real gems in here that we can actually take and expand. And so my personal experience pre-COVID is that every unit had one of these boards, and it was full of ideas. You'd walk down the hall and be like, oh my gosh, this is amazing. And then post-COVID, the boards were still there, or the opportunities to identify our opportunities and solutions were empty. Mm-hmm. And so it really paused me to question what's going on. And so I did just some independent research or whatever. And I came up with I found this German philosopher or psychologist, that has this concept of functional fixedness. And so functional fixedness is when due to trauma, life events, whatever, people can get into a mindset where there's only one solution to a problem, one way of doing things. So a really classic test is that you give somebody a nail and a piece of wood and say you have to hammer this nail into a piece of wood. But you give them a screwdriver, a shoe, and a brick. And people who are in a state of functional fixedness will be like, well, I don't have a hammer. I can't do this, without thinking that maybe there's another way that we can look at this problem. And so my personal observation, my personal theory is during COVID, so much of the innovation or idea generation was actually taken away from us. You had to walk into a grocery store in this door, exit this door. You could go this way down the aisle, but not this way. You wanted to go for a hike, you could only go one direction. So there was a lot of problem solving that I think was intentionally taken away with us for a purpose, because that's what you do when you're in emergency, and it's command and control, and you come up with decisions, again, based on the best information that you have available to you at the time. But post-COVID, I don't know if we ever gave people the permission to start thinking innovatively again, to start thinking about what our opportunities for improvement was, because a whole generation of healthcare workers actually graduated post-secondary and came into the profession during COVID, where again, we weren't. So we have to get back to here somehow. And so this is, again, what lights my soul on fire. Like, how can we get back to people feeling encouraged to come forward with their ideas, so they're invited and feel invited to share their ideas, that they can, there's this one challenge, this one opportunity that we're faced with. Tell us how we can solve it together and then be effective, because then people also feel part of the solution. Mm-hmm. And so how can we get back to that? So that is, again, one of the things that motivates me in the portfolio that I have, is that we can help people. We can help people who are in those frontline positions and leaders who are leading the workers in the frontline positions to get back to that. Mm-hmm.
I absolutely love that. And I think you're definitely, the right person for the job. Was it Dr. Devin Harris that was in the role before you?
He is the medical dyad for this role.
I see.
So
okay.
Dr. Glenn McRae, who's now our Vice President of Quality Research and Academic Affairs, he was in this role before.
Oh, okay.
And did a ton of work to really build the foundation for this role. And so I'm very grateful now to actually have a VP that is so close to the work that I do.
And he's a nurse as well.
He is a nurse by background.
Yeah.
He's got his PhD. He's got a ton of experience in this realm, and can be a little bit of intimidating. He's truly got a PhD in this work. But it's fantastic to have his knowledge and expertise. And then Devin has remained as the executive medical director, and obviously just, fantastic at everything he does and a huge source of information. And both Glenn and Devin have such amazing relationships across this health authority as well, is that it's just been an incredibly rewarding role to step into and continue on with the work that it started. Yeah. Mm-hmm.
And I'm so grateful to have you basically on this podcast and talking about this, because I think one of the misconceptions that is promoted in the media with all of these negative news stories and certainly we saw this too a little bit post-pandemic, is that, the health system doesn't care. Like it's just trying to keep the lights on and the, the doors open and, move people through beds. And I really appreciate being able to have you come and talk authentically about, like, there's so many people, like, literally from the ground up that really, really do care, and that your job is to help empower those people on the front line to implement their ideas on how things can be better, because who knows better than they do?
Absolutely. Yeah. And, short staffing or staffing shortages is an easy one for me to use it as an example. There's a lot of frustration that we need to be hiring more. You're absolutely right. We need to be hiring more. But healthcare right now, this health authority, this site, we are competing for the exact same healthcare workers that the entire globe is competing for. So what's going to set us apart and make people choose us? And that's what we need the collective wisdom around. There's fantastic work going on at a provincial level, regional level, municipalities to recruit people. But what are we missing? That's the piece of information that we need from, and, again, what motivates me in this role, using that as just one very big example of how, if we work together and bring solutions forward, okay, what are we missing? How could we be doing this differently? Because we don't have all the answers in leadership. So that is, yes, it very much excites me.
So I'm gonna actually double click.
Yes.
Because also, one of your within your portfolio is, and I know this is work you're super passionate about, because you came to me and said, I'm working on this thing and it's really exciting. And I knew this existed because Devin had also spoke to me about it. But I kind of want to double click on this. So you work with Doctors of BC.
Correct. Yep.
And on the IH Physician Quality Improvement Program. So this is physicians, Doctors of BC and physicians. So what is this, and why does it light you up?
Oh gosh. So absolutely. So the Physician Quality Improvement Program is it's a program that's funded by the Specialist Services Committee of Doctors of BC. So it is, and so Doctors of BC and the SSC recognized or recognizes, I should say, that physician engagement, again, is so important in the work that we do.
Yeah.
And I have always, in all of my leadership positions, truly believe in integrated leadership. So, healthcare these days is way too complex that administrators cannot do it alone. Physicians cannot do it alone. We have to work together. So all of the work that we should be doing in partnership and leveraging the expertise of both disciplines. So physicians, like nurses, like physiotherapists, occupational therapists, they're the ones that are immediately dealing with the patients. And so they have obviously an immense amount of knowledge as to, again, the opportunities in the system that we need to make improvements on. But they're experts in the provision of clinical care. But not every physician that goes through medical school will get the training on how to do a quality improvement project.
Right.
And so and this is a simplified version of it, but a physician has a patient in front of them, they do an assessment, they come up with a plan, and that plan's put immediate in action. But to drive quality improvement is not that linear.
Right.
It's very messy, and there's lots of peaks and valleys, and there's tornadoes that you'll get,
sucked into,
and there's bureaucracy that you have to work through. And it can be very frustrating, and it can also be very disengaging. And so what this program does is offer resources to train physicians on the process of quality improvement and the steps of quality improvement, to leverage as an engagement opportunity to leverage their ideas. And any physician who's applying to be in this program is paired with an operational partner, a dyad, to work through that project. So now we've got people who are working through these problems together, coming up with joint solutions, working through all the hiccups and tornadoes together for, again, the purposes of driving change. And it's just outstanding. It is so rewarding. Within the quality improvement portfolio, we do offer training for interior health employees for quality improvement training, but this is one that physicians and IH staff can work together in the training to come up with potential solutions. So it's really focused on the training, but it doesn't stop there. So through this program, there's ideas that they can go to the next level and go to spread quality improvement. So now we can take these ideas and spread it to other sites or other programs or other services and continue to grow it. Like, it's just truly outstanding. And having the opportunity to work with these very engaged physicians who are interested in learning this, it's not for everybody. It's absolutely not for everybody. But we need that diversity in healthcare. We need people who are very, very satisfied and their souls are lit on fire with just doing patient care, not just doing patient care. There's no just in there.
Right. Yes.
But staying focused on that. But the physicians who want to get involved in this, yeah, we'll teach you.
Yes.
Yeah, we'll get you excited. We'll give you the resources. We'll go through all those hiccups and tornadoes together. And then what's this amazing product that we can come up with at the end? Mm-hmm.
Yeah. And there are, like, to your point, like, there are people that just can't sleep at night.
Yep.
Like, because they want to solve this problem.
Absolutely.
I know, because I'm one of these people. Like, I'm just like, we could just do this better.
Yes.
Right. And then there are other people who are like, this is good. You know, like my role is to do this and work with the patients and give the best care possible. And that's great too. Like,
Absolutely.
honestly, but if you have that little seed in you that is just, it just like burns, it's just like, I feel like I know how to do this better, and
absolutely.
I need somebody to hear me, you know. Those are, I imagine, the kind of physicians that are attracted to this program.
Yeah, absolutely. And the learning is always amazing because there is nothing easy about change.
Right.
There's nothing easy about quality improvement. It doesn't just happen overnight. There is a process. And it can be frustrating because sometimes the process takes a lot longer than what you would anticipate or expect for the size of the project. But this gives awareness, and this gives learning, and this gives understanding. And again, they're working through it together with somebody that they trust in the organization. Yeah, it's pretty fun.
That's great. So the cohort 7,
yes, it's amazing.
Just kicked off. So this program started in 2019. Yep. Now you're at cohort 7. You've, what do you call it? Graduated? Trained? 94 physicians throughout the interior health region.
Yep. And it is truly a graduation. So we've had 92 people who've successfully completed the PQI program.
Amazing. And so now we're welcoming cohort 7, and we're very excited because we have 7. I know you're IH wide and you don't have any favorite children whatsoever, but I'm in here at KGH. And so I'm very excited because you have 7 physicians from KGH. Who are participating in the program. And are you able to share just kind of like a little bit, like very high level, you know, you don't have to say who they are, but like maybe what their backgrounds are.
Yeah, absolutely. 7 physicians, and actually not just KGH, actually Kelowna as a community. So we actually do have, I think, at least one family provider as well who's in this cohort.
Amazing.
It is truly amazing. And the projects are fantastic, and they span the continuum of care. So we've got a few initiatives that are aimed at harm reduction, tobacco reduction, and what that could look like. We've got some in one of the physicians is in medical microbiology in terms of how we can do some improved screening. It's oh my gosh, the projects are actually just so exciting. And so what's interesting about it though is that some of the ideas, and this is part of the whole process, the ideas that they submitted for their application will probably tweak by the time. And so as they start to learn some of the methodology, it will likely look different at the end as well. So, which is learning in itself. Like what you think is the easy problem, you're like, oh, maybe
I didn't think of that.
It might be too big. It might be too small. It might not fit in here. But I'm super excited. It is a very, very good cohort. And I think we're going to see a lot of great things come it. And I think, again, there's going to be a lot of opportunity for the people who are enrolled in the PQI cohort to then potentially go on to the next level, which again, now how can we actually spread this idea?
Yeah, right.
So I forget the date. It was just a couple of weeks ago. I think I had an opportunity to present to this cohort, and it is truly one of the most engaging groups I have ever spoken in front of. And so I'm probably a little bit biased because it's the cohort I'm going to have the most involvement with just because I'm still new in the role. So many questions, so much passion, so much motivation. And again, that gets me excited. Yeah. So it's going to be outstanding.
It's very exciting. And is there, you know, I am so happy that you're here to be able to share and welcome this new cohort. Maybe we can send this episode to them and
absolutely
just be like, look how excited we are for you.
Oh, yes,
it's
absolutely.
Yeah. Do you know how many are in the program?
In total, I would have to count. I think we have just under 20.
Okay. Yeah.
But that's a pretty substantial amount, especially when you think of every one of those physicians is partnered with somebody who's, again, working in
Right.
clinical operations. So it's a lot of work that they have to go through to learn the process, but there's some great ideas out there. Mm-hmm.
I look forward to hearing more about it. That's why I was asking too, is like, we'll get you back and be like, ooh, this is what we got.
Yeah, absolutely.
Okay, so I'm going to switch gears now because I'm getting the flag like that we have to finish. See, it goes by. It
does go by very fast.
Jaymi was so worried, nervous.
For anybody in the future, it really does go by quite fast.
Yeah. So I'm going to switch gears a little bit because part of the joy that I get out of this, and I think the value that we can bring to community is really humanizing the people that are working in healthcare, and getting your perspective, both from, you're a clinician, you've been a nurse, you've been an administrator, you were in leadership, but you're also a mom and you're a wife and you're, doing trick-or-treating and like all these things, householder, paying bills, all that. How has your definition of health and what constitutes healthcare changed over the years?
Just going to end with an easy question.
I know. And I gave it all that context. Like,
I don't know if it's changed. Healthcare is a journey. And so you it's imperative that you live a healthy lifestyle. And ideally, in a perfect world, you don't need the services that we offer in a hospital. But if you do, we're here. And so so through that entire continuum from prevention, secondary prevention to, if you need services, is just so important. And we truly do have to continue to figure out a way to provide the best services that we can with the challenges that we're facing.
Yeah.
Short staffing, because of the short staffing, obviously services struggle to stay operational, but we have to keep the focus on what that is. So, and we will not be able to do it unless we're all working together on it. So I know with my own family, I do have 2 young kids and I do have aging parents, and it truly takes everybody working together in order to make sure that we all have what we need in order to live a healthy lifestyle and to stay healthy at home and everything that we need to do. So I don't know if it's changed. It's just been maybe reinforced that this is what we have to continue to work together.
Yeah. This is going to be a really random question. And like,
Black.
What's that?
I'm kidding.
Okay. So I am good friends with a number of physicians and nurses and all of that in my life. And like, there's sort of like a spectrum as to how you apply. I say this job too, like even for me working before I came to be working at the hospital foundation, I just worked, in ad agencies and stuff like that. But then I got here and then I all of a sudden started to like know enough to be a little bit like annoying with my family. Right. Okay. So I'm going to ask you, there's a spectrum of like moms, right? Like that work in healthcare. There's the like, don't touch anything, wash your hands, bubble wrap, like mask, all these things, which is like, this is totally not a judgment thing. Like I get it because when you know,
Yep.
Right? And then there's the other end of the spectrum, which is like, the kids are out eating the dirt and, what, like it's not it's just like, yeah, just go live your life and be right. Like, I was the eating the dirt mom until this job. And now my kids are like, why are you always on Google? I'm like, ugh. Yeah. So where do you fall on that spectrum?
I'm definitely on the dirt eating end of it. And I would say probably as a parent, my husband's probably the more caring one. And so there is a joke with nurses that we either, seek care way too early or wait way too long.
Yeah.
And so if left to my devices, I'll probably wait way too long. Except when it comes to, I don't know what happens to my kids when we go into an airport. They need to touch everything.
Yeah.
So that's the only time
you're conscious.
I do become more conscious.
Yeah.
Like I don't know why that door handle of it or the rail, like I don't understand it.
My thing is theme parks.
Yeah.
And escalators.
Yeah. Elevators.
Oh,
Yeah, no. So that's the only time where, but the falls at the playground and stuff like that, I will probably.
you're like, you're fine.
Yeah.
Suck it up.
You're you don't need life support. You're probably going to live.
You can say that though, because if something was really wrong, you're like, I got this.
I got this. Yeah. So
all my BS essay writing isn't going to really come in handy.
Yeah.
Like, Jaymi, help.
Yeah.
So what areas of your health? So this is a wealthy podcast, kind of a play on words. Health is wealth. And we know that health comprises a whole gamut, everything from physical, mental, spiritual, emotional, community, blah, 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 family, all of it. What areas of your life do you feel wealthy?
Oh gosh, so many. I'm truly blessed, if you will, with fortunes in this instance. So family is definitely very important. Community is very important. So, for me, when I say that, like the friends that surround us, we do pride ourselves on enjoying a very healthy lifestyle. So we like all of the outdoor activities. I do enjoy cooking. So eating healthy is important. And just even our downtime as well. So the mental health portion as well. So very, very fortunate and do feel very wealthy in all of the things that do make up, in my opinion, a healthy lifestyle. So
nice. Okay, so now I'm going to ask you the hard question.
Oh my gosh.
It was on the list, Jaymi, sort of.
Okay.
What areas of your health or your life where do you feel like what are you working on?
Absolutely. So that's a very interesting question this time of year with the time change and the changing of the seasons. So I always have to be, extra focused on my own, I guess, mental health at this time of year when it starts to get darker. I love being outside. I love the sun. And so this is my time of year where I have to make sure to take extra special care and attention to get outside and to have that fresh air, to make sure that I don't just hibernate, that I continue to exercise. So it's always what I focus on this time of year. So yeah,
it's really good. I am the same. Thank you, Jaymi.
Thank you.
You did fantastic. And I knew you would because you're so passionate about your work and about this community. And I'm just very, very grateful to you for sharing from your heart, but also from your mind as well, and all the work that you're doing with your colleagues here at KGH and throughout the Interior Health region.
Oh, well, you guys are experts in what you do as well, and it's always a pleasure. Thank you for thinking of me for this podcast. So I'm very humbled by the opportunity. So thank you.
Thanks, Jaymi.